Hello guys, welcome back to No More Cavities. Today we are discussing about the foramina and fissures of the inferior view of the base of the skull. These are the stylomastoid foramina located at the temporal bone. They transmit the stylomastoid artery and the facial nerve. The next one in line are foramen spinosum. The foramen spinosum houses the meningeal branch of the mandibular division of the trigeminal nerve. The next foramina are found on the palatine bone and are known as lesser palatine foramen and houses the lesser palatine nerves and vessels. Then we have greater palatine foramen and they are located anterior to lesser palatine foramen on the palatine bone and they houses the greater palatine nerve and vessels. The next one is foramen ovale. They are found on the greater wing of the sphenoid. The foramen ovale transmits the mandibular division of trigeminal nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. The next foramen are found on the temporal bone are known as mastoid foramen, transmitting the emissary vein. Now we will discuss the largest of the foramen known as the foramen magnum. It transmits the medulla oblongata, the vertebral arteries, the spinal roots of the spinal accessory nerves. Next are the foramen lacerum, but they do not carry any vessel. They are filled with fibers and cartilage, and they have anterior opening for pterygoid canal and the posterior opening for the carotid canal. It is located between the greater wing of the sphenoid and the body of the sphenoid bone. The next is carotid canal, present on the petrous part of the temporal bone, transmitting the internal carotid artery and the internal carotid nerve plexus. The internal carotid nerve plexus contain the sympathetic fibers. The next are the condylar canals, present behind the occipital condyles, transmitting the emissary vein, meningeal branches of the ascending pharyngeal artery. The next is the inferior orbital fissure, transmitting the zygomatic nerve and the infraorbital vessels, present between the lesser wing of the sphenoid and the maxilla. Next are the petrotympanic fissures, containing the chorda tympani, a branch of the facial nerve and the anterior tympanic artery. The next one is incisive foramen, present on the palatine process of the maxilla and housing the nasopalatine nerve and the sphenopalatine artery. The last one is jugular foramen, located behind the carotid canal, transmitting the internal jugular vein, inferior petrosal sinus, posterior meningeal artery, glossopharyngeal nerve, vagus nerve, accessory nerve. This was all about the foramina and fissures in the inferior view of the skull. Thanks for watching.